Thank you. Hello, everyone. So now I'm going to present an example of a participatory research project that was co-produced with patients, patient advocates who participated with us in the research team from very early on in the project, from the inception of the project when we were thinking about what type of research questions we wanted to have. We were writing the funding application proposals, and they participated as co-researchers throughout the analysis of the data and dissemination and knowledge translation. Okay, and so I'm going to talk about the participation aspect of the project. I'm not going to talk about the research in itself, but I'm going to tell you a little bit about the research so you understand the context of participation. So we conducted a research project funded by the NIHR, National Institute for Health Research in the UK, which is called the Sickle Cell Life, Voices and Experiences of Young People with Sickle Cell. And we wanted to explore the experiences of young people with sickle cell disease as they transition from pediatric to adult services. And we wanted to understand this transition in the context of other transitions in life, okay, other social aspects of their life as they move into relationships and education and work. And so as I said, the focus on the presentation is on the participatory aspects of how we work with patients as co-researchers in the team, rather than on what we found about transition, right? So first, that was the slide I should have showed you before, sorry. But first, what is sickle cell? So sickle cell disease, I don't know if you know what it is a genetic blood condition that causes very painful, severe, painful episodes with risks of a stroke and severe infections. So young people have to spend quite a lot of time in hospital when they have a painful crisis or painful episode, and they sometimes don't know when this is going to happen. So I'm going to show you, well, maybe I wait for the rest until they come and I show you something. But why did we think as a research team that participation was important in our project? We wanted to involve patients in our group because sickle cell is a condition that is often ignored and is invisible in health services. It's very marginalized in health services as a condition unless it's in a specialist context, hematology specialists. And patients feel very disempowered when they use health services, and they trust services. Sorry, they mistrust services. So patients encounter a lot of barriers when they try to negotiate care in healthcare encounters when they are in the hospital. And their patient expertise, their knowledge in their own body and condition is often disregarded by healthcare providers when they are in the hospital. And for us, their patient expertise was very important, and we wanted to incorporate that and have that at the core of our team. As a research team, we wanted to work with them because they are experts. And they also sickle cell, why also we wanted to work with them to amplify their voices and to ensure the research focused on their needs and their preferences and responded to what they wanted to see happening in health services. Also is because complicating the situation further of like the lack of knowledge of how to treat sickle cell in services is the kind of the stigma around the condition and the fact that patients need to use opioids for dealing with pain and sometimes are being stereotyped as drug seekers by non-specialist staff. So they encounter many barriers when trying to receive the care they need for a painful episode in hospital. And so we wanted to amplify the voices of young people with sickle cell. Also, the project was about young people, and young people's voices are often ignored. So we also wanted to amplify that. So several reasons why it was important to include them as co-researchers with us was the fact that the condition is silenced and is neglected, but also young people's voices are often not listened to in health services. And sickle cell patients are experts in their own condition and their own body, so we need to listen to them, right? And we really wanted research questions to be influenced by their priorities, so we work with them to influence research questions. So yes, I want to show you something. before we start, and it's a video to raise awareness about sickle cell that an artist has recently produced. I hope it's still here, yeah. And it's a very powerful account of what it means to live with sickle cell. I'm gonna play it now, okay? So that video is by A Star, who suffers from sickle cell as well, and he has done a fantastic functioning way the video to raise awareness about sickle cell and what it means to live with a silence condition and hidden condition. So there were many reasons why it was very important to ensure that patients with sickle cell were part of our team. With this, I've gone through them. We wanted to ensure we could amplify their voices because of the reasons I've explained before, and we wanted through participation to minimize barriers between scientific and lay expertise, because it was important to kind of bring those together. So I'm going to now, as I said, I'm not going to present the findings of the project, but I'm going to contextualize what we did and then give you examples of how we worked with patients, how we did participation. So where did this project came from? So I was doing the research in Clark that I presented before. I was looking at patient participation in improving services, and I came to meet patients with sickle cell, and we were also very interested in transitions to adulthood, and we worked with them before we applied for money to try to think about research questions and things that we thought we should think about and address through research, because we realized that there was a gap in social research. There was biomedical research, but there was no research looking at the social aspects of living with sickle cell. So it was great that we worked with them from the very beginning, and we combined their expertise as patients, our expertise as researchers. We also brought clinicians into the team, and we designed the project together. What is great is that they've continued to be participants and co-researchers with us until now, that we are translating the evidence that we've produced through the research, and they are working on the dissemination with us, etc. And we've even co-authored a peer academic publication with them, which we didn't expect we would do. So we feel very lucky to have worked with them, and we think it has worked very well. So a brief explanation about the research. We looked at how young people with sickle cell move from children to adult services. That is called transition, which is a long process, and we wanted to look at how that medical transition interacts with other transitions in life. So we looked at the social aspects of their lives, and it was important because when children become adults, everything changes. They've been in a service for a long time, their clinicians change, and that happens in a context where their parents maybe are less involved in their care, and also they are undergoing other changes in their lives. So transition is a very important period to look at. So I ended up doing 80 interviews with 48 young people with sickle cell, and some of them were repeated, so I did 3 interviews with some of them. And we also asked them to record a diary. It was a very open brief. They could record a diary between interviews, which was either photographs or written or audio. And that didn't work so well because it was voluntary, and they had a lot of work already with exams and a lot of anxiety about work. So we didn't kind of ask too much. We thought it was too much of asking them to do it. And some of them said that they didn't do it because they were busy, and some said they didn't do it because they didn't want to keep thinking about sickle cell. Look, they did the interview and that's it. They don't want to keep concentrating in the condition. So we only had 7 diaries, and most of the evidence we've produced is through the interviews. Right, so how did we do participation? So I'm going to give you some examples of the way we work with what we call patient advocates. So our patient advocates were 2 young people with sickle cell and a carer of a patient with sickle cell who had care for his son through transition as well. So the 3 of them brought different experiences. And working with them has been vital for us. We felt very lucky that they wanted to work with us because it has ensured that their views are into the research questions. They shaped they saved the proposal from the beginning, the grant proposal. So we did some kind of workshops with them about what they wanted to prioritize. And like, for example, one of the things that they wanted to prioritize is to ensure that the NHS meets the aim of no decision about me without me. So we ended up including that as an aim, and we looked at how young people are being involved in decisions about their care during transitions, where the healthcare providers involve them in their care. The two young patient advocates said that it was very important that the project had some kind of tangible outputs that will empower young people to move during the transition period with confidence. So we've ended up using the findings to inform a project to improve a program to improve transition. So everything was what they said we incorporated in the grant proposal, and we were very lucky that we were funded and then we could do it. So they influenced the project from the very beginning. So another example of how they influence the project at the beginning is like the young people said we shouldn't talk about disease. It has a lot of stigma. So in our, as you see, in our kind of public title of the project, we don't use disease. We talk about sickle cell life, and we don't use the word disease. We do it in some of the academic papers, but not, yeah.
And how do they perceive sickle cell? Do they perceive as disease?
They perceive it as something, a condition they live with, but the disease had some kind of negative connotations. They are aware that some members of the public, that because in the UK not so many people know about what it is, so they think it's contagious. So maybe the connotation of something that you can catch is what they didn't like, you know, the negative connotation. So they have helped from, as I explained from the beginning, when we were developing the program, the study design as well. We were thinking about how to do the interviews. They said it was very important that we were flexible and we could conduct some of the interviews in young people's homes just because of the pain. They explained how winter would be a very difficult time for us to do interviews because sickle cell is affected by cold. So that's when they are ill and they get crisis. So they said to us we need to be flexible about that. They've also been participating in the analysis. And I'm going to go through it now, one by one. And the way, like we had, originally we had thought we would have a steering committee and they would be part of the steering committee, but we've ended up developing very ad hoc, flexible ways for them to participate, where rather than large meetings, we had smaller meetings with them at times and moments where it worked for them. And using formats that were a bit more informal, like maybe going to a cafe and talking to them rather than sitting down in the university and having a meeting with them to discuss issues of the research. This is a graph that represents the different types of participation that we had in the project. So we had the two young patient advocates and the other patient advocate who was the carer, and they've been core members of the team from the beginning. But also we have involved other people throughout the research. We have involved patient charities on like discussing the findings and how we can translate the findings into useful resources for young people. I've also been part of an early years steering group, sickle cell steering group from another project from Clark, where I also had a chance to involve other patients and even clinicians and charity representatives who were part of the steering group in discussing aspects of the project. So we've done participation in different ways, and the different stakeholders have been involved in the project. Okay, so that's the graph. So, participation during inception. I've already talked about some of these issues before, but so when we started to write up the research funding application, we held workshops with patient advocates. The young patients they had a charity they had created called Broken Silence, and then we also involved the father of a sickle cell patient. And in terms of we were talking about engagement before and recruitment, I was very lucky that I already had these relationships. So I could work with them from the very beginning. But I can see colleagues now that they are writing funding applications and they want to do involvement and they don't really know where to go and to start developing the relationship. So what was good about this is that we already had a relationship and it was easy for us to have participation from the very beginning. So they help identifying research questions, setting the aims and objectives that I've told you about. And then it was great that we got funded. They couldn't understand how long things took. So we had to explain how, it takes a long time to get the funding, and then you get the reviewers' comments. And something that didn't work so well was that when we got the reviewers' comments, they only gave us 1 week from the reviewers of the grant application to respond to the comments. And that timeline didn't really work for us to involve them. We didn't have enough time to then go to patients and our patient advocates, and so we had to do it ourselves. And then we fed back to the funding agency, who are great, and I'm sure now they've changed that, and they are a bit more flexible with deadlines, so that patients can be involved at that stage as well. So during data collection, so they helped a lot with recruitment. Recruitment of sickle cell patients was very difficult. So we had ethics approval to recruit from hospitals and from the community. From hospitals, it took a while because ethics took a while. So because we had ethics approval from our university, we could start recruiting from the community. So we didn't have the contacts. The sickle cell community is very small. And so one of our patient advocates helped us with the recruitment. But then when we trained her to do the research, she had run out of contacts to do her own interviews. So we trained her to do interviews. We gave her training in qualitative interviewing, ethics and data management, but then she found recruitment very difficult because she had already run out of contacts of the interviews we conducted, and then she was like, I see people in the hospital, and I was like, yeah, but you can't recruit in the hospital because of ethics approval. We didn't have ethics approval for her to recruit from the hospital, and it was quite difficult for her to find people to interview. So at the end, she didn't interview anyone, but she's been really actively involved in the analysis with us. So participation during analysis. And okay, so we have some drawings here from an event that we did with patients at the end. So you are going to see some of the drawings. So participation during analysis and knowledge translation. So we work closely with our patient advocates in the analysis, and we had some kind of reflective analytical workshops with them where we presented some of the preliminary findings and discussed the interpretation with them and put findings in context in light of their comments. And also these reflective workshops were very useful for me to then know what I should focus on when I was looking at the data again. So I went back to the data, and then I held workshops with them again where we discussed again the findings, and they help us interpret the data. And we've not only involved them in that, we've also involved them in knowledge translation. So their contributions to the analysis were so great that we thought it was not fair for us to have publications with them without them. They had to be recognized. So we published a paper with them where we kind of try to think about how do we do it in a way that works for them and is not too onerous, and we are not asking for too much, and how we do it in a way so that it's not gift authorship as well. So we ensure their contributions are being inputted into the publication, and we've ended up doing, and we've had a meeting with them the other day to reflect upon how it was, and it seems that it worked very well for them and for us. We were happy with. They were also very happy about having that evidence, like the paper, that now they can take when they advocate for improvements in services. So now they said, so one of them had gone to a meeting to talk to nurses about sickle cell, and she had the paper. And so in a way, the paper, or the academic paper, helps her support the evidence coming from experiential knowledge that, as we discussed before, sometimes it's difficult to kind of recognize it as legitimate, not from us, but from maybe clinicians. And then we've also worked with them, with our patient advocates, to think about how to translate the findings into useful resources for young people. So they put us in contact also with the Sickle Cell Society, which is a patient charity, national charity, doing fantastic work to fight for the rights of people with sickle cell. And we work with them to use findings from the research to fit into a program to improve transitions for young people with sickle cell, which is called SOS, Self Over Sickle. And parts of that program are informed by our findings, and also other parts of the program are informed by what the Sickle Cell Society knows about the experiences of young people with sickle cell through their network of patients that they have through the charity. So maybe I talk now. So that's the program. It's called Self Over Sickle Cell, and you have links to the different resources that they've created. So the program, just to go very quickly through the program, the idea of the program is to improve physical, psychological, and social and emotional aspects of young people, well-being of young people aged 16 to 25 years old, and after various reflective sessions and knowledge translation meetings with them, the SOS project staff used some of our findings to inform some of the aspects of the program. So I don't know if I have it here. Let me have a look. Yeah, okay, so that's the slide. So one of the things we found was in our research was about social silencing and how young people were silencing the condition. And that, combined with the fact that there is poor awareness of what sickle cell in society, created like a risk environment for young people, where if they had a pain crisis, they couldn't get the help they needed because people didn't understand what sickle cell involves and how it needs to be cared for. And the young people really, like, transition for them was a way of learning how to silence the condition from others. So the program, the SOS program, focuses on peer-led conversations between young people that tackles the social silencing of sickle cell, and it tries to build confidence in vocalizing what sickle cell is, and also it helps young people talk about the social aspects of living with sickle cell. And this is informed by our findings. And also the SOS program is combined with an advertising campaign, and the aim is to raise awareness to the public about sickle cell as well. So in a way, it's addressing the social dimensions, the wider context of sickle cell, which we thought it was a big problem, or we found it was a big problem for transitions in sickle cell. Another aspect of the program that is informed by our findings is the self-actualization and self-preservation tensions that young people have. Like, they have this tension during transition about trying to be very productive and become successful in their careers, etc. So self-actualization, but then self-preservation, which is about taking care of their condition and ensuring they self-manage. And these internal battles that young people experience are also addressed in the program, in the SOS program. So young people often know the facts about sickle cell and the biomedical aspects, but they don't kind of talk about the personal concerns. So the program is looking at facilitating this. One of the aspects as well, so one of our patient advocates worked with us in the knowledge translation and worked with us with the SOS program staff. And one of the things she reiterated is that it was very important for this program to be participatory, and it was her idea. So the program was going to be kind of expert-led, but because of her input, so this is how her input was used into the program ended up being participatory as well, and it was peer-led, so it was also led by young people themselves. Also, our patient advocate said that it was great because he was super assertive in the meetings. As he said, like, we need to ensure that this program has some kind of tangible resources that are left there for other young people with sickle cell who are not being involved. So the program ended up, so then the program developer was thinking about, okay, what type of outputs? And they ended up developing some podcasts and some YouTube series and social campaign that is left there for other young people to use. and some video clips as well. And everything is on the links, and you can have a look at that. But it was great to see how there was participation in our project, and the participation of our patient advocates was influencing the research, but also then they were even influencing the development of the program and the intervention. So another aspect of the program where we've done participatory work is that our research, but also the meetings with the different stakeholders and the charities, help us realize of the importance of, rather than trying to improve young people and increase their knowledge so they are better at transitioning, we had to address the social context of the condition. That was where the problem was, right? We had to raise awareness, we had to remove a stigma, and so we had to work with the social context where young people live to support them during transitions. So in light of this, we work with the engagement team at the Royal College of Pediatrics and Child Health to deliver a participatory event with the stakeholders where we discuss the findings and we co-produce with them resources or ideas for resources to improve transitions for young people that were dealing with the social context of their lives. So the participatory event was planned with young people and led by young people, some with sickle cell, others without sickle cell, and we also had as participants other stakeholders that we wanted to influence, and we thought they were important players that could help improve transitions. And by this we refer to educators, so people from schools, staff from schools, A&E, so emergency staff and non-specialists. We found that a big problem in the care of young people with sickle cell is non-specialist staff in the hospitals. So we also invited these stakeholders to the event to talk with young people to discuss how we could translate the findings and how each of them could bring their experiences and combined with the findings, think about resources to improve transitions. So the event was great, particularly because the engagement team at the Royal College of Pediatrics and Child Health is fantastic. So they had fantastic facilitating skills to make everyone engage in dialogue and reflect upon the findings and their experiences, and we wouldn't have been able to do that by ourselves. We presented at the beginning the video that you've seen from the rapper A-Star, which was very powerful. Because some of the non-specialist staff and the education staff didn't know so much about sickle cell, so it worked very well. And then at the end of the event, I mean, there was some kind of outputs from the event. Some of the participants did pledges about what they would do, and like some of them, like there was a secondary school teacher that said, now I'm going to go to my school and I'm going to show them the video and I'm going to discuss with the students what sickle cell is so that they learn about it. There was someone else who said, I'm going to go back to my community and encourage Black and minority groups to donate blood. There was an emergency A&E staff that said, I'm going to go back and we're going to have some training and I'm going to make sure the training incorporates something on sickle cell. So they all did these pledges that were fantastic. And then also the event has generated some meetings with key stakeholders. Some kind of strategic partners that are important in trying to influence improvements in healthcare for people with sickle cell. So one of them, for example, it was the engagement team at the Royal College of Pediatrics and Child Health who held a meeting with strategic partners from the NHS to think about how digital health solutions like mobile phone apps could include something about sickle cell, so to reflect about how they could incorporate something in their digital health solutions for sickle cell. Then there's been outreach in the school, so some of the findings and the reflections from the meeting have been taken to a road show to schools in England to raise awareness about sickle cell. And then a patient that came to the event and a nurse ended up giving a talk about transitions and mentioned the event and the findings and the project. So, and I think still some of the outputs from the event are happening in terms of there are still more meetings happening to reflect upon the findings and yeah, and what to do next. So reflections very quickly. No, we still have a bit of time. Yeah. So that was the event, some photos from the event. We did a lot of work in groups to co-produce ideas and to think about what to do next. And we had clinicians as well as parents and patients, and that's us at the school, LSHTM. And we had Nordia from our team, our patient advocate, was also co-delivering the event with us, which was great. And these are some of the drawings from, we had a cartoonist, and these are some of the drawings from the conversations we had during the event. That's us. Our patient advocates here, and one was traveling, was on holidays, but it was great. And Nordia, is a patient advocate who gave a fantastic presentation at the event. And there was some kind of Twitter activity around the event, which was great. So it expanded. Even A-Star, the rapper, tweeted about the event. So we were very excited that he was talking about the event. So reflections about our participatory process. So we know it takes a lot of time. It took a lot of time for us to ensure, we were doing this, not only research, but to ensure you maintain the relationships and you ensure that everything happens in the right way. We were lucky, as I said, that we had already developed the relationships, so we could work with them. We were very lucky that we applied in the funding application, we applied for money to compensate for their time. So I didn't feel guilty that they were there with me at the time when I was getting paid, but they had to be recognized as experts. So we had money to compensate for that, and it was great that our funder wanted to do it. Any type of activity they've been involved, there's been compensation. We thought it was good to do this to make sure the relationships were equal. We were at the same level, more or less. And we wanted to recognize their expertise because we felt very lucky that they wanted to work with us. So challenges, not really many, apart from the fact that what I mentioned, like the funding, when we were applying for funding, we didn't have enough time to incorporate their comments. In between, we received the reviewers' comments and we had to submit the revised version. But we fed that back, and our funder was so great that I'm sure that they will change that. We were very lucky also that our funder helped. We kind of help us include one of the patients as a staff, and we were paying her as a staff when she was going to do the research, and they were happy about that. So they were happy about the changes we did. We said at the beginning in the proposal we would have a steering group with them, but then we told them, look, this doesn't work. We need to work with them in a different way. So they were happy for us to change the format of participation. So that's kind of in terms of challenges, that's what we had. And then I was very lucky to work with Sam, with my colleague, and Cicely, and we were a team working together to make sure we could do participation, because sometimes you don't have enough time to do it properly. So we were sharing tasks, etc. So I have quotes from them about how they felt about their participation, and I can read some of them. So one of them is like, working with LSHTM on the Sickle Cell Life Transition Project has been a pleasure. Not only my point of view and experience as a person living with sickle cell disease has been utilized and considered as professional expertise, I have been empowered and trained to partake in the project in a more hands-on role, and I have been invited at every stage of the project to contribute and co-produce content based on the research outcomes as well. And then basically they were mentioning how it was more collaborative rather than we were not consulting them, we were working together as a team. And then what really helped us to participation was, as I said, having the resources to compensate for the time, having established the relationship, working in a flexible way so that we could adapt to their needs and their commitments. Two of them work and they get sick, so we had to work in a way that if it fitted with their work commitments, but also to their health. So we had different formats. We had group meetings or their individual conversations on the phone, or we went to closer to their communities where they wanted to meet, and obviously we compensated for their time. Yeah, and we felt like that was a way to make the relationship more equitable. Yeah, so we've published some papers from the research, and one of them, this one, is published with, which one? This one is published with them, I think. This is in critical public health, so we've published that paper with them. And then we've published different findings, and now we want to work on a publication to reflect about the collaboration that we had and to see whether we can help others, and yeah. So, we have some publications via our website as well, and references there. Do you have any questions, or we have, I think, 5 minutes before. Any questions about the project or the participatory aspect?
How long the whole project took you, Alicia?
So very long.
Yeah.
2014 we started,
Yeah.
and we've just finished now. We are writing the report.
Yeah.
It's taken a long time.
Yeah. Yeah.
Yeah, it's taken a long time because of the field work.
Yeah.
Yeah.
And working with different groups.
Yes, the different involvement, and yeah, it's been a long project.
Can I have another one?
Yeah.
In terms of co-publication, you're going to include them for all publications or just some?
So, yeah, only some. I think we had a conversation yesterday or today about the academic language, and
Yeah.
so two of them, like one of them, and this is my fault because I am very theoretical and sociological, so this one is very kind of technical sociology,
Yes.
very kind of, and I don't think I don't know, I assume they wouldn't enjoy, we recognize their input, so in the acknowledgement, but in the write-up it's very sociological, but they've participated in another one, and we want to do now another one where we're going to co-author with them.
The reflection.
Yeah, the one about patient involvement and participation. So, yeah, maybe we should have involved them in all of them.
Yeah.
Yeah.
That would be good too. The reflection one would be good because they can say about things that they have to go.
Yeah.
Good.
And it was good. It would be good to, to have that for other people who want to do it. Yeah.
In my book, please.
Eh?
In my book, please.
Ah, yeah. Yeah, okay.
When you're including participants in publications or in writing, so how do you cite their name?
Yeah, so that's very interesting. We had this dilemma where they were asking us, the journal, they wanted the ORCID number, ORCID, like one of them had participated in another publication, but they wanted the institution, and we were like, Sam, my colleague, was like, which institution? Like, I don't know. So we were calling them and asking them, what shall we put? I don't remember what we put at the end, but and at the end, I think Sam was very assertive and said, no institution. Like the affiliation, they wanted the affiliation. And I don't know whether here, I can't remember, for one I think we said, like we asked them, what do you want us to say? Because the journals have this very structural way of presenting people's profiles. So yeah, that was a very good question, thank you.
Thank you for the nice presentation. Hearing about your project about the sickle cell, working together with the younger patients, and going back to your lecture in this morning about the technocrat patient, the concept of it, what is your interpretation of, does this concept apply to younger people as well, or how did they change their behavior over time?
Yeah, it's funny because I was more focused on like ensuring I was very focused on ensuring they were okay, because I had heard so many complaints from other patients when I was looking at participation that we really valued whatever they brought to us from their own experience as living with sickle cell. So they brought really detailed knowledge about what it means living with the condition and receiving services, but also like really the technical knowledge that they had developed knowledge, particularly the care about the workings of the NHS, the inequalities for sickle cell, how you know, there needs to be more commissioning of sickle cell services. So he also has a very good knowledge about the NHS and health services, and we took all of that. For us, it was great that they wanted to bring both types of knowledge. We felt like we wouldn't have been able to do it without their expertise. So they had expertise of their own condition, of caring for someone with sickle cell, but also of like years of advocating for improved services for sickle cell as well. So they brought that as well, which was very useful for us. Yeah. Okay. So I think we are moving on, no? Now. Yeah. Thank you very much.